Dr. Maggie Nolan, welcome to the program.
Thank you so much for having me.
We've seen in September and October a significant spike in new COVID cases in Wisconsin, among other states. What is driving that, do we know?
Well, I think there's a number of things driving it. In public health, we think about one single exposure or risk rarely explains it all. It usually is a constellation of factors, and unfortunately, we have many of them in Wisconsin. Right now, with the weather turning colder, we're moving indoors. We have a strong culture of independence here in Wisconsin and wanting to not be told what to do necessarily, but certainly by the government. So we have a lot. I think it's both cultural and it's just the fact that the weather's getting colder. I will say we also have a lot of geographically sparse regions in the north of Wisconsin, and a lot of the social culture revolves around taverns and pubs and supper clubs. And you're sitting elbow to elbow, you're facing a bartender, you're shouting over the Packers game, your mask is down as you eat and drink. And these are things that are deeply ingrained in Wisconsin, and I think that's certainly contributing to it.
Dr. Nolan, there seems to be a schizophrenia between the more libertarian elements of Wisconsin Authority and the more liberal elements of Wisconsin Authority. Do you think that might be creating a worst case scenario for both sides?
I do. I think that's very well put. I think that COVID requires a very centralized response, and what we have is a very piecemeal one. Even our state, mask mandate it's very hard to enforce public health laws at the state level. They have to be local ordinances, and then they're selectively enforced. So we let a lot of market factors, for example, drive, whether a store allows masks or not. That type of approach is never going to be good for mitigation of this disease.
So what is the product of that? What are you seeing at the coalface now with new admissions to hospital, people seeking treatment for COVID now?
Well, unfortunately, we are breaking our state records. We have 241,000 cases so far, 2,100 deaths. We've been averaging the last week or so 5,000 new cases a day. The result is our hospital capacity at about 85%. 87% of our ICU beds are full. So this is really troubling, especially as we go into the winter and all those other people who don't have COVID who need ICU level care. This is really not a good situation.
Doctor, there's so many more cases at the moment in this wave, not just in Wisconsin, but across America. But at the same time, there's also a lot more testing and there's a lot fewer deaths. So how should we evaluate the seriousness of this wave compared to the first wave?
Well, I think we have learned a lot, and it's good to focus on those positive things. I think we've learned a lot as far as the epidemiology, so what puts certain people more at risk. And ideally, the mortality is partly lower because people who are at higher risk of dying from COVID are taking more precautionary measures. And then we know a lot more about the treatment. And really, the mainstay of treatment is still how do we treat the complications of COVID? So now we know that people with severe COVID get blood clots. So we use blood thinners early and in some states on all patients prophylactically or to prepare. We know that people get kidney injuries, so we're quicker to see it and put them on dialysis. So a lot of this is just stuff that we've learned, which is great. However, that needs to be within the context of numbers. And there's things about this surge that are very different. First, this surge, at least in Wisconsin, is bigger. Second, in the United States, if 42 states are seeing surges, even if they aren't as large as Wisconsin, mobilizing resources, personnel, we can't bus in people from surrounding states in the Midwest because they're all fighting their own battle. And this is going to be a problem with therapeutics, with all sorts of resources, just because of the number of states seeing surge.
One of the features of the first wave, Doctor, across the United States was a shortage of PPE, basic equipment, as well as the therapeutics that are known to have a positive impact. What's the situation in Wisconsin now? Are you ready for this wave?
Well, we did a lot. John, preparing between the springtime and this surge, and that is great. We've stocked up. We have currently enough PPE. People are adequately protected. But again, I think the anticipation is the rate of growth and whether we're going to be able to keep up with that. This, in many ways, was not anticipated to be quite as large as it is. So it's good that we laid a lot of groundwork early, but I think we are anticipating situations of shortage. So that's partly what I've been involved in, is trying to figure out how do we allocate those scarce resources, whether they're ventilators or therapeutics or PPE.
Let's assume a vaccine is greenlit in December, say. When would you expect America to finally get this virus under control?
Under control it's going to take a little while. The number of things that have to happen after a vaccine is approved takes several months, and we're working to decide who would get the vaccine first, second, and third. But even so, I mean, at the earliest, 6 months for a baseline level of immunity that would allow us to kind of function more normally. But probably we'll be wearing masks and taking precautions. Certainly as members of non-high-risk groups, we'll be doing that for a long time.
Finally, Doctor, I understand and respect your need to stay above the partisan political fray, but I wonder, in terms of the political process that is going on in Wisconsin, the voting activity, the rallies, etc., is there any evidence to suggest that all of that is contributing to this wave, or are these just coincidental events?
Well, I suspect that the people who are attending these rallies where they're closely packed in without masks, I think they're probably the same folks who are living their life that way outside of the rallies. So I do think that that people have all different risk tolerances, and it's probably just highlighting that. I don't know that it's necessarily in and of itself contributing, but I do think it does outline and highlight the risk-taking behavior that's contributing to this surge.
Just one more from me, Doctor. People focus on the deaths, and rightly so, but what percentage of hospitalised patients would you say end up with long-term conditions as a result of COVID?
Well, that's a great question, and I think that's where a lot of research needs to happen. There's definitely glimmers that it's a lot more people than you would guess. What we do know more concretely is that the folks who end up in the ICU, so at least in Wisconsin, that's about 20% of patients who end up in the hospital. Those folks who end up in the ICU and survive tend to have a whole syndrome of issues afterwards, psychiatric, cognitive, and physical, that will require really intense long-term therapy and physical occupational therapy. And so I think it's just the tip of the iceberg right now for what we're going to need to plan for in the future.
Dr. Maggie Nolan, we really appreciate your time. Thank you so much.
Thank you both so much.